End the HIV/AIDS scourge in women. The revelation by the new Director General of the National Agency for the Control of AIDS, Gambo Aliyu, that 6 out of 10 persons living with HIV in Nigeria are females, must not be handled with levity. It is startling and shows the heavy burden faced by women living with the HIV/AIDS scourge in Nigeria. All the 3 tiers of government, non-for-profits, and the multilateral organizations should redouble their efforts to eliminate the scourge. Aliyusaid said that young Nigerian women were 3 times more likely to be living with HIV than men of the same age group. This is disturbing and women of all age groups deserve special care, the NACA DG, who made this known at a news conference to commemorate the 2024 International Women's Day that fell on March 8, called for the empowerment of Nigerian women and support for women living with HIV/AIDS. According to NACA, 1.8 million persons are estimated to be living with HIV in Nigeria, out of which about 1.63 million are already on the life-saving medication of antiretroviral therapy. This is encouraging, but more needs to be done, especially for women. Despite significant progress in global efforts to combat the epidemic, women and girls in Nigeria continue to face formidable challenges, from lack of access to medication to pervasive stigmatization and discrimination. According to the latest statistics from UNAIDS, Nigeria has the second largest number of people living with HIV/AIDS in the world, with approximately 1.9 million individuals affected by the virus. This adds to Nigeria's notoriously awful human development indices and woeful health indicators like malaria, infant mortality, maternal mortality, and tuberculosis. Alarmingly, women and girls account for a disproportionately high percentage of new infections, highlighting the urgent need for targeted interventions to address gender disparities in HIV/AIDS prevention, treatment, and care. Recently, the Association of Women Living with HIV/AIDS lamented the alleged discrimination against women living with HIV/AIDS by Nigerians. Ashwan stressed that discrimination against victims of HIV/AIDS is a serious issue that should be addressed by the health and political stakeholders. The group's coordinator, Catherine Egbola, made the call during the commemoration of the 2024 International Women's Day, held in Akure, the Ondo state capital. One of the most pressing issues facing females living with HIV/AIDS in Nigeria is stigmatization and the lack of access to life-saving medication and healthcare services. Despite efforts to expand access to antiretroviral therapy, many women and girls continue to struggle to obtain essential medications due to factors such as poverty, geographic barriers, and inadequate healthcare infrastructure. In rural areas and underserved communities, accessing HIV/AIDS treatment and care can be particularly challenging, with long distances to healthcare facilities, limited availability of medications, and high out-of-pocket costs hindering access to essential services. As a result, many women and girls are forced to forego treatment or rely on suboptimal healthcare alternatives, putting their health and well-being at risk. Moreover, the pervasive stigmatization and discrimination associated with HIV/AIDS exacerbates the burden on females in Nigeria. Women and girls living with HIV/AIDS often face social ostracism, rejection by family and community members, and even violence due to widespread misconceptions and fear surrounding the virus. In the fight against HIV/AIDS, Nigeria must prioritize the needs of females and address the structural barriers that impede their access to medication, healthcare, and support services. The government must invest in strengthening healthcare infrastructure, expanding HIV/AIDS testing and treatment programs, and promoting comprehensive sexual and reproductive health education for women and girls. Furthermore, efforts to combat stigmatization and discrimination must be intensified through targeted awareness campaigns, community engagement initiatives, and legal protections to safeguard the rights of individuals living with HIV/AIDS. By creating an enabling environment that respects and supports the rights of women and girls affected by HIV/AIDS, Nigeria can mitigate the negative impact of the epidemic and empower individuals to live healthy and fulfilling lives. Despite the challenges, there is reason for optimism. Nigeria has made significant strides in its HIV/AIDS response, with increased access to testing and treatment services, and a growing commitment to addressing gender disparities in HIV/AIDS prevention and care. However, much remains to be done to achieve the ambitious goal of ending the HIV/AIDS epidemic by 2030, as outlined in the UNAIDS Fast Track Strategy. The human immunodeficiency virus and acquired immunodeficiency syndrome epidemic began in 1981. HIV has no cure. Once someone is infected, it is for life. Left untreated, it can lead to AIDS, which is a chronic immune system disease. As of 2023, it had killed 40.4 million people, per the World Health Organization. In 2012, AIDS killed 630,000. This underlines the ghastly global threat of the epidemic. Target 3.3 of the Sustainable Development Goal seeks to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases by 2030. As the international community works towards achieving Goal 0, 0 new HIV infections, 0 AIDS-related deaths, and 0 discrimination, Nigeria must redouble its efforts to accelerate progress and bridge the gap between rhetoric and reality. On the global front, the WHO certified Cuba as the first country in the world to eliminate mother-to-child HIV transmission in 2015. Thailand followed in Cuba's footsteps the following year when UNAIDS said that with 1.1%, it was the first Asian country to eliminate mother-to-child transmission in 2016. In contrast, Nigeria had a burden of 26.9% MTCT in 2017, per America's National Institutes of Health. Nigeria is one of 4 countries with over 10,000 new pediatric HIV infections per annum, it said. UNAIDS certifies a country free when transmission is less than 2%. By investing in women and girls, strengthening healthcare systems, and confronting stigma and discrimination head-on, Nigeria can lead the way in the fight against HIV/AIDS and create a brighter future for all its citizens. The burden of HIV/AIDS on females in Nigeria is a multifaceted issue that demands urgent attention and decisive action. With the correct political will, strategic investments, and a commitment to gender equality, Nigeria can overcome the barriers that stand in the way of ending the HIV/AIDS epidemic and ensure that no woman or girl is left behind in the journey towards a healthier, more inclusive society.